We just need to go back a little bit because this is potentially quite serious. You've now got two separate clusters from healthcare workers spread from hospitals from two separate returnees to Australia. And what we've been saying for several weeks now is the highest priority has to be securing our borders. This is not going to get into aged care or anywhere else unless it escapes from our borders. So borders completely immunised, households, and they were late to households. New South Wales was onto households of border workers, but now that's belatedly part of 1B. And we now find that the next layer of defence against people coming in, which is healthcare workers looking after them, have not been immunised properly, two people not being immunised. And what we know is that if you get the Pfizer vaccine, about 10 days after you've had it, you actually do resist infection. And we're not even giving Pfizer vaccine to most of our healthcare workers. And PPE, where Queensland was saying that they were following national guidelines, and the national guidelines still do not fully acknowledge airborne spread and say it's okay not to wear an N95 mask for somebody with COVID-19. So we've had, these are systemic breakdowns. They're not necessarily the fault of individuals. We don't know about the nurse, whether she caught it directly from the patient or not. And it's been circulating for a long time, particularly after the first episode with the medical registrar at PA. So you don't really know where this virus is. The more people come forward for testing, the less likely you are to be missing something. And the more they test and the more they contact trace, hopefully they will find all the cases and be able to link them together. But it's these mystery cases where things could explode.
It just strikes me there seems to be so many inconsistencies between each state's response still after all these months. Do they not learn off each other?
You'd hope that they do. And we haven't had these episodes in other states, particularly Victoria and New South Wales, where they're taking in larger numbers of people from overseas. And so one assumes that they've done this, but we're not absolutely clear. What should have happened, my belief is, for what it's worth, is that we've got the strategy wrong with the rollout of the vaccine. We should have just had this total focus on barrier on barrier on barrier on our borders and really just seal them in with the vaccinations and seal them in with Pfizer. And the main reason for using Pfizer is you're done and dusted in 3 weeks with 2 doses. It takes 12 weeks with Astra. And it's probably a bit more effective vaccine as well. But you're protecting the healthcare workers against disease, but you're also protecting against transmission.
But Norman, I thought that the jury was out in terms of whether when you've had the vaccine you could potentially still be carrying the virus, and are you infectious? I know it prevents serious illness, but I thought the jury was out on that.
There's a study in the United States of, I think it was about 40,000 people. Some people who'd had the vaccine, some people who hadn't, who were being COVID tested before they actually went in to have a medical procedure in hospital. And what they found was that this was largely of the Pfizer vaccine, and that was the figure I quoted, that 10 days after the vaccine, you actually had a high level of resistance to what's called asymptomatic infection. So, and there's also evidence from Public Health England, Public Health Scotland, not Public Health England, the Israelis are showing reduced asymptomatic infection. So reduced infection where you've not got symptoms, that's when you spread it. So that the assumption then would be that you reduce transmission. You're right that the full chain of events hasn't been absolutely nailed, but the circumstantial, and practically stronger than circumstantial evidence, is that they do reduce asymptomatic infection and therefore spread. That's why this virus is a pandemic virus. It spreads when you don't have symptoms.
And in this case particularly, there's been a long period that people have been in the community potentially infected. And I think perhaps the difference as well, there's been a lot of movement of these people.
Yes, it's not their fault. They didn't know they had it. And they go down to a party in Byron Bay and they got to Gladstone and they go all over the shop. And that's what people do. And particularly in Queensland, where we've not had very much virus around. And when I was in Brisbane on Saturday, I knew that there was virus around, and I was getting quite anxious and avoiding crowds, trying to find somewhere to eat which didn't have a lot of people. The ground is tilled ready for a pandemic because people's behaviour takes off. You don't necessarily have to have the B117, the Kent variant, as it's now called, the UK variant, highly contagious, for this to take off. This virus is contagious enough, and if our behaviour is such, it'll just move off into the community.
At the start of the pandemic, Norman, the Queensland government was reluctant to do snap lockdowns, as we're calling them. What's changed and how effective can they be when we know incubation periods?
It's not so much for the incubation period that you lock down. It's more just to settle things down and stop any more virus circulating until the contact tracers have got the cases that they can find and be able to tie them down so that you know that they're linked. What a 3-day lockdown does is it kind of stops the virus in its tracks. It's not so much that you burn it out by, you'd have to lock down probably for 2 or 3 weeks to start burning out the virus, or even longer than that, in fact. This is more to just pin down the virus, don't stop any further infection spread or minimize that while you sort out the contact tracing, and then make sure that you know where every person has got the virus from. So,
I mean, I know it's impossible to put specific numbers on it, but from a purely scientific perspective, if the numbers were 0 tomorrow, the lockdown, I'm hypothesising, if the numbers were 0 tomorrow, you could come out of lockdown after the 3 days. If there's perhaps 2 more cases or 4 more cases, I mean, is that simple as it is?
Well, I must declare an interest here because I'm in lockdown and therefore I've got skin in this game. I think it's not so much the numbers, it's how many mystery cases you've got. So I think that if there were 2 or 3 cases tomorrow and you knew exactly where they came from and it was all making sense in terms of a narrative, then you could be much surer about that. I find it, so I've got no idea, but I think that they'll find it hard. If they've got 2 or 3 cases tomorrow, even if they know where they've come from, I think they're going to find it hard to say we're going to lift it from Thursday night. It's hard to see how they were going to lift this earlier than Good Friday. But I'm hoping. I'd like a weekend off, but I'm not sure about that.
Or maybe not 2 weeks or perhaps longer. If the lockdown is extended, do you think more states will then feel obliged, feel it necessary to completely shut borders?
That probably is a numbers game. I think that if New South Wales finds there's been significant spread in northern New South Wales, and remember that spread could then come down. Byron Bay, Noosa is called the northernmost suburb of Melbourne, and Byron Bay is the northernmost suburb of Sydney. People will come back down into Greater Sydney, and I think that that would be the worry in New South Wales. But whether they think the horse is already bolted, I don't know. But border closures do work. They're just incredibly traumatic.
I want to ask you what you think about the statewide mask mandate. When the cases are specific at the moment and we know the locations, is a statewide mask mandate completely necessary? And does it not just alienate the people that you want to be encouraging to do the right thing?
I think it is, because you don't know where this virus has gone yet. If this was just, all your cases were in Greater Brisbane, well, they are, but I mean, if people hadn't travelled to Gladstone and other places, and you don't know, there's 2 weeks of spread nearly before the other cases emerged. People could have gone anywhere. They could have gone and had a weekend away in Cairns, in Port Douglas or Townsville, and you just don't know where people are at the moment. And, I can understand if you're in Charters Towers, you think, why am I doing this? But I think along the coastal region, it makes good sense. It does reduce transmission by 60 or 70%. It's a small price to pay, and it may only be until Thursday or Friday.
I just want to ask you something that struck me. We heard from the Chief Health Officer in Queensland that they now have 71 cases in hospital in Queensland. In most countries, the majority of cases don't go to hospital. They are quite mild infections or even medium infections, and they stay in the community or are treated by healthcare workers in the community. Is it the case, because we have so few cases here in Australia, that the absolute majority end up in hospital?
I think that is one thing that varies from state to state. I think some places have positive cases in maybe hotels, so that you're actually in a specialised hotel. And I'm not entirely across exactly what each state is doing, but you're absolutely right. If we had a flood of cases where with people who are being seriously ill, requiring intensive care, or emergency rooms clogged, then I think you would find mild to moderate cases being held back and being treated in the community. And obviously, every time you move somebody, even from a hotel to a hotel, you create risk. And certainly you create risk in the middle of the night. Princess Alexandra, a diligent medical registrar, has to see all her patients. She goes and sees the patients, and then bingo, you're infected.